Humerus. The humerus is the long bone in the upper arm that connects the shoulder blade, scapula, to the bones of the forearm, radius and ulna. It is the largest bone in the arm and is divided into three parts: the proximal end, the shaft, and the distal end. There are several types of humerus fractures, depending on the location and severity of the break. Proximal humerus fracture. This type of fracture occurs near of the humerus, usually at cervical neck, the shoulder joint, and at greater tubercle of humerus. In this case muscles, subscapularis, remains attached to the humerus and pull the limb into medial rotation. It is common in older people with osteoporosis, as well as in athletes who fall on an outstretched arm or suffer a direct blow to the shoulder. Nerve damage in this case is axillary nerve which passes through the surgical neck of humerus. Midshaft humerus fracture. This type of fracture occurs in the middle of the humerus, and is usually caused by a direct blow or a fall onto an outstretched arm. It is more common in younger people and athletes. In children, fractures of the shaft are often green stick fractures. Other types of fracture of shaft are transverse fracture, spiral fracture, comminuted fracture, compound fracture and oblique fracture. Radial nerve is usually damaged in fracture of shaft of humerus. Distal humerus fracture. This type of fracture occurs near the bottom of the humerus, at the elbow joint. It is often caused by a fall onto an outstretched arm or a direct blow to the elbow. Median nerve is usually damaged in distal humerus fractures. Intercondylar humerus fracture. This type of fracture occurs in one of the two bony projections at the bottom of the humerus, near the elbow joint. It is often caused by a direct blow to the elbow or severe fall on flexed elbow or with high impact injuries such as in a motor vehicle accident. Fractures of medial epicondyle usually damage ulnar nerve. The treatment for a humerus fracture depends on the type and severity of the fracture, as well as the age and overall health of the patient. Treatment options may include immobilization with a cast or brace, physical therapy, or surgery to realign and stabilize the bone.